When we first got the news that COVID was spreading outside of China's borders, we started buying PPE. And it was really important for us to stay open for our kids and be available. And we did stay open. We kept our hours exactly the same, and we're available for our patients.
We have done a lot in our practices to convey the message to families that it is safe to come back, and we're trying very, very hard to protect families when they come into the office. That way they feel safe.
So once we were over the original surge and we felt like things were settling down, we understood that we really needed to start getting kids in for more routine care, some of the older kids, and to start catching up on vaccines.
We set up a lot of procedures in place to make the office safe.
So we're limiting the number of patients in the office at a time. We're limiting the traffic flow patterns to make sure that everybody's moving around safely.
Everyone is wearing a mask, both the providers and the patients.
We're changing our gloves. We're washing in between each and every patient.
You come in, you register, you go straight into an exam room. So I would tell them that it's actually a very safe time to come into the office.
We work really hard to minimize the risk, and what I always encourage parents to remember is that we're on the same team. My job is to keep your child healthy. All of the physical problems that were there before coronavirus are still there. If you don't treat them now and early, it becomes a worse problem later.
If children start not getting their vaccinations because parents are afraid to come into the office because of COVID, then we're going to start seeing some of the common illnesses that we rarely see now thanks to the vaccines.
We found that we were down about 40% in vaccine delivery in children in Rhode Island. So we really have been focused our efforts to kind of get those numbers back up. So it's super important for us to be able to, identify the kids that have either, are due for their shots or are a little bit behind, get them back in and get ourselves right up to speed.
So what we've been doing is we're calling families back to get them back into the office, back on track.
If you're wondering whether or not you should call us or whether or not you should come in, then you should just call us and we can talk about it and we can make the decision together. We are here to try to keep your kids healthy. We totally understand that you have concerns, so talk to us.